welcome to the Mike Rich Show. My guest today is Dr. Carlton Richie III, make it all sound formal. He is a family practice trained physician and also sports med. What makes him unique is he's a DO instead of an MD. So one question, Cardi, can you tell me the difference between an MD and a DO?
Sure. So first of all, kind of describe the similarities. So we both go to 4 years of medical school, and then after that, it's whatever you want to do in terms of, family practice, internal medicine, general surgery. One of the big differences lies in the first 2 years of your training. We get 200 hours of musculoskeletal additional classroom work. So we learn about the interaction of the muscles, the bones, the ligaments, viscerosomatic responses, like if your stomach hurts, why do you have a headache? And then, as you know well, the laying in the hands on the patient. So the way to affect change through manual medicine. So whether it's to change the muscle tension strength, work on the myofascial fibers, Golgi tendon body stretch reflexes, all the things that sort of create change. You could almost say very chiropractic in a way, but I don't know the details of chiropractic to say more other than we are laying hands on the patient. And then there's a whole holistic approach, which is sort of if you sprain your ankle, why does your shoulder hurt? You sort of get that information about, make sure you pay attention to the rest of the human being. So that's sort of in a nutshell.
No, that's cool. And that's the reason I love having you at rodeos, because you use your hands. A lot of MDs, it's prescriptions and x-rays and maybe sew someone up, but they always want these tests. You'll actually put your hands on someone and say, why does your shoulder hurt? Let's figure this out.
Right.
Which good doctors will do it too, but
Sure.
MDs. So another question for you, like you went to Midwestern University and now you're an associate faculty? So you teach 1 day a week or something?
Correct, yeah. So I started off just in the clinic where the students would follow me around. And I teach some things like shadowing, if you will,
Yep.
and then that headed into actually working at Midwestern in Glendale 1 day a week. And then after so many years, you can put together what they call like a dossier or a portfolio, and you can kind of have what they call advancement. And so I had some research I'd done at the time, which kind of helped advance me. So now I'm associate as opposed to assistant. And I've been there since. They've asked me to go further if I would like to, but I'm still working on some research to get that done.
Yeah. I knew you were smart, but I didn't know you were that smart.
I'm definitely not.
I thought your wife was always smarter.
Yeah, she's the neurologist in the family for sure.
So on that note, the reason I brought you here today, I want to talk about over-the-counter medications, which a lot of lay people don't even know the difference between Advil, Tylenol, Aleve. Can you tell me like a generic name for them if they buy generic? It's not going to be called Advil,
Right.
ibuprofen. How it affects the body on at least those three main two.
Absolutely. So the first big group of medications would be anti-inflammatories, non-steroidals, of which you have Motrin, ibuprofen, Advil, Aleve, and then naproxen. Those are all very similar chemical structures and very similar mechanisms of action. They're both an anti-inflammatory and a painkiller. And you all know from your vast experience in the training room that you've got guys in, you want to kind of tackle both immediately many times. You want to get swelling down, you want to kill the pain. And so that's where that medication comes in really nicely. Ironically, you don't really even get a great anti-inflammatory effect for several days. So if I give you one dose of ibuprofen, you're getting the pain relief qualities of it, not a lot of the anti-inflammatory qualities. There's a lot of upsides and downsides to using those medications. The anti-inflammatory class goes through the kidneys to be metabolized. And so you have to watch out for folks that have hypertension, diabetes, maybe some renal failure that's chronic, to make sure you tailor the dosing and the duration of therapy to any issues related to the kidney function. Another big thing, which is a common side effect of the anti-inflammatories, is stomach upset, or actually gastrointestinal bleeding. In fact, we have more GI bleeds that result in death every year than we do from car accident deaths.
Really?
So as you mentioned, people gobble up the anti-inflammatories, don't know the side effects, GI bleed and die.
Oh, mackerel. Yeah, and that's the problem with a lot of people I deal with. They think if 2 is good, 4 is better,
Yes,
maybe
sir.
6 will really make me feel good. And then they do it for an extended period of time, and that's when they get to bleed. So I
Right.
usually tell them, try to follow the prescription, what they recommend on the bottle, and then try to limit for a week or so, and then wean off of it and see how you feel. And if it's still hurting that bad, go see a doctor.
Yeah, great attitude. And you, as I know, on the over-the-counter world, they really dumb down the dosing. In fact, we both will have patients that come in, hey, Mike, I took 200 milligrams of Motrin and my shoulder still hurts. And you're like, that's what I gave my 5-year-old kid. And so you're like, hey man, we need to get in the 600, 800 milligram range to really get after it.
Yeah.
And that's of course to be safety in the OTC market, but also to give you a lot of latitude as a trainer or a doctor to really get into the dosing strategies.
Like a lot of times people, I'll recommend acetaminophen with ibuprofen the first couple of weeks or 10 days, which be Tylenol and Advil basically for people. Do you think there's a big difference between generic medications and name brand?
Yeah, great question. So in the world of generic and trade name, there's what's called a tolerance of efficacy. And so with a trade name drug, you've got about 105% all the way down to 95% of the actual product in that, we'll call it 200 milligram pill. If it's generic, it can go up to 115 or down to 85% to still meet what's called dosing tolerance. Yeah. Over the course of a week or two, it's really not going to matter. But if you just have 1 or 2 doses, the trade name Advil might be better than the generic ibuprofen just to get your exact dosing down.
And by the way, Advil doesn't pay us any money. It's just a common name brand. Other questions for you there on medications, like went over non-steroidals.
Yeah.
What else you got for me to educate people on?
Yeah, well, you mentioned the other big class of drug, which is Tylenol or acetaminophen. So what are the pros and cons of that drug? Well, the big pros of that drug is you can take it without regard to food. With the Advil type products, you want to have food on board. So again, you don't get the gastric ulcer or upset stomach. Tylenol is disregarded to food, so you can take 1,000 milligrams of acetaminophen or Tylenol, disregarding food, up to 3 times a day safely. The downside with that is twofold. One is it goes through the liver to get metabolized, and you can't drink any alcohol, beer, or wine with acetaminophen. There have been cases of people who are jacking a bunch of the acetaminophen or Tylenol. They go home and grab a few beers or have a couple glasses of wine, and it actually can put them into actually liver failure, and that requires hospitalization.
Yeah, we had that with a barrel racer actually that did that and did
Tell
it
me
for
that story.
10 days. Yeah, and her liver or kidney started shutting down. Renal failure.
Okay.
But they bounced her back out of it. Thank goodness they caught it in time. So on there, other questions I have for you, like a lot of my population that watch the show, their best friends may be their dog or their horse. And I know a lot of people that sample with veterinary medicines for humans. And I know ivermectin, everybody knows, is the COVID deal.
Yep, that was a big one that crossed over.
Yeah, but it crossed over a bit. I've never seen the proper dosage. Have you?
Yeah, great question. So yeah, because dogs and horses and cows and things like that, they are a whole different weight. The active ingredient may be exactly the same, but the dosing could be way off. So what maybe 1 pill for a horse is 10 pills for you and I.
Yeah.
So that being said, I suppose in a unique situation, if the patient brought in the actual milligrams and the pill, maybe you and I could work together and say, hey, you're going to cut this in tenths to get what you need if you're in a desperate situation to get it from the human pharmacies and things like that.
Community
exactly.
We mentioned that about penicillin off camera.
Yeah.
But there's a lot of that stuff. It's the biggest thing is you got to do your research. Talk to a medical professional. Someone like Cardi or me or my program. I mean, you can call us and we'll give you what advice we can. But bottom line is animals metabolize a lot of things differently than humans. So you're always rolling the dice a little bit when you use a vet product that was designed for a cow or horse on a human because we metabolize differently.
Yeah, great point. Because don't cows have like 2 or 3 stomachs or something, Mike?
Yeah.
So I mean, who knows how long it takes to digest those.
Very true. And like I said on there, like a lot of people eat Tylenol like M&Ms, highly don't encourage that. I did notice though the other day when I was at the pharmacy, my old concoction, which came from a doctor, was Advil with Tylenol short term. But now one of the name brands is combining the two.
Interesting.
Yeah.
So great thought, because you've got the painkiller properties of the Tylenol, and you've got the anti-inflammatory properties of the ibuprofen products mixed together. Just make sure that that patient's eating some food and staying away from any alcohol, beer, or wine. And like you mentioned, kind of a limited duration of therapy days.
So everyone out there, if you're taking a lot of Tylenol, you got to quit drinking. So you may want to switch over to ibuprofen.
Yeah, I would say definitely 8 hours from your last Tylenol dose for any alcohol, beer, or wine, because that's usually the length of duration on that.
On the thing there, with any other advice you can give, like a lot of us will probably be rural community, people that travel a lot that are watching an app on their phone or something. What some advice you would give a patient in your office if they came in with a sprained ankle, like gross swelling, something like that?
Yeah, so we use the acronym you guys use, Mike, PRICE, P-R-I-C-E, so protect that ankle, relative rest, ice, compression, and elevation. And as you know, ice isn't always convenient, so you get into the things we chatted about. Ice is a painkiller, ice is an anti-inflammatory, so then you start going after your acetaminophen and your non-steroidals like your ibuprofen to kind of get after those two things. And really one of the biggest ones is protect.
Yeah.
And again, relative motion. So you don't want to immobilize that joint because you've worked with those guys that, hey, Mike, I haven't moved my ankle in 5 days since my injury. Aren't you proud of me?
And then it doesn't work. Yeah. And on closing, I want to talk about, because you're over here on your lunch hour, One Medical. You've been with them for how long now?
6.5 years.
6.5. So besides your deal with Northwestern, what is, I think, looking on your website, like you guys do a little telemedicine.
Yep.
You're bilingual,
Yep.
which I didn't know, but I can't speak, so I won't try. So what can you tell me about the office? How many clinicians are you there? How many doctors? And
Yeah, great. Well, thanks for asking. So we have 8 total providers. We have actually 4 DOs and 1 MD. So we do a lot of manual medicine in the office. And then we have 3 what we call allied health providers, which are the NP and PA folks.
Yep.
And so they help out when I'm like booked up that day or whatever, someone needs to get a quick Z-Pack for sinusitis or something. We do lots of virtual medicine. COVID really helped. We have a really nice sort of virtual platform. So if you're at a rodeo in Texas, you're like, hey, Cardi, I think I got strep throat and need a Z-Pack. You can just pop in real quick on the internet, either virtually or on just a message.
and say off.
And say or just send. I've had patients just send pictures of the strep throat. And they'll say, hey, Mike, where's your nearest Walgreens or whatever? And boom, we'll send that in. So really helps folks with traveling, or if they have something pretty convenient, like if you're a hypertension patient, you need to get your your hypertension medicines really quickly, we can help with that as well. So kind of a combination of in the office stuff. We do derm work, we'll do biopsies and excisions, lots of sports medicine. We have another sports med guy, so we'll do ankle, knee, shoulder injections, whatever. So pretty full spectrum. We don't deliver babies or do prenatal care, but pretty much from age 14 and up, we'll take care of anybody.
That's cool. Good to hear. And as you can tell, I've known Dr. Richie for quite a few years. You've helped me.
23 and a half.
23 and a half now. Just advice for trying to get out there about medications, pros and cons of using over-the-counter. Doing too much was the biggest problem I see. And then the vet industry, and you got to do your research if you're going to look into that. You got to, which online's helpful, but if you can talk to a medical provider, I think it'd help you a lot.
Yeah, and to that point, Mike, as a DO, we're really holistic. So we advocate, bring in your veterinary medicine stuff. Let's work with you as opposed to turn you away, because you might have the right drug for the problem. We just want to find the right dose to keep you safe.
Read the label.
So
if you need someone, like I never thought about telemedicine while we're traveling, that's huge for my crowd that are on the roads all the time.
Yeah, I mean, I have a lot of folks that travel for a living, and so One Medical does provide a nice venue. There is a membership fee. It's a couple $100 a year, but then that buys you all those benefits for the whole year. And we're just going to drag you in usually once a year to get a set of vital signs, grab some blood work on you, but other than that, you can just kind of be free and do your thing and feel like you're connected to the medical community. Sort of like when if you buy State Farm for your car insurance, you don't want to ever use it. You spend some money to have it, but you're glad it's in your pocket if you need it.
Very true. Well, thank you very much for coming today, Cardi.
Thanks a lot for
Great
having me,
to have
Mike.
you.
Just great, and I wish you all the best as you move in this journey.
All right, thank you.
All right, man.